The health blog. Nosebleed. The medical name for a nosebleed is epistaxis. When blood comes out of the nose, it is more commonly known as a nosebleed. Nosebleeds are very common. Most nosebleeds look worse than they are. In other words, nosebleeds are messy, a little uncomfortable, and sometimes even scary. But they are no big deal and can often be treated at home. Who gets nosebleeds?
Hmm.
Anyone can get a nosebleed, but they most commonly occur in the following: young children, the elderly, pregnant women, people who regularly take aspirin and blood thinning medications such as warfarin, and people with blood disorders. Kids can get nosebleeds once in a while or more often. The nosebleeds that are most common in kids usually occur near the front of the nose, on the wall separating the two sides of the nose, which is the septum, and usually start from just one nostril. What causes nosebleeds?
Hmm.
Common reasons are nose picking, a cold or allergy, especially with sneezing, coughing, and blowing the nose very hard. Dry, heated indoor air, often occurring during winter, which causes the inside of the nose to become cracked, crusted, and itchy. An object stuck in the nose, direct injury to nose, including a broken nose, overuse of blood thinning medicines such as warfarin or Coumadin or aspirin. Less often, injuries to the outside of the nose, face, or head can cause nosebleeds. If this happens, you need to see a doctor right away. You can help prevent these types of nosebleeds by wearing protective gear, such as helmets for hockey, football, and baseball, and any other sports or activity that requires them. Home care. You know that you should see a doctor if your nosebleed was caused by an injury like a punch to the nose by someone or by playing some sports like hockey, football, and baseball. But if it just starts bleeding on its own, you can easily treat it. Follow these steps: sit down or stand, stay calm, use tissues or a wet washcloth to catch the blood, tip your head forward, don't lean your head back. This can make blood run down your throat and you might get choked. Lightly squeeze or pinch the soft part of your nose, below the bony part of your nose. Breathe through your mouth. Do this for 10 minutes without stopping. Don't pick, rub, or blow your nose. This can cause your nose to bleed more. If your nosebleed doesn't stop after 10 minutes of pressure, pinch it for another 10 minutes. Here are some other cases when you need to see the doctor or visit the emergency department. If bleeding still hasn't stopped after 20 minutes, you feel dizzy, weak, or faint, like you might pass out, your nose is bleeding fast, or you seem to be losing a lot of blood, you have other symptoms such as uncommon bruising on your body. After the bleeding stops, try not to blow your nose for a more than few hours and avoid sneezing. Preventing nosebleeds. Most nosebleeds occur during the winter in cold, dry climates. Use humidifier at home or use petroleum jelly, nose spray to keep your nose moist. Avoid picking your nose and blowing your nose hard if it is blocked due to a cold or a hay fever. Wear a head guard while playing sports in which your nose could get injured, such as boxing or rugby. Stop smoking. Smoking adds to nasal dryness and irritation. After having a nosebleed, a crust will form inside your nose. This may be unpleasant, but try not to remove it as it It is part of the healing process and will help prevent nosebleeds from reoccurring. With the right treatment, people get well from nosebleeds with no long-lasting effects. Vocabulary: bruising, a dark and painful area on your skin that is caused by an injury. Dizzy, having a whirling sensation in the head with a tendency to fall. Faint, like you might pass out. Humidifier, a machine that adds moisture to the air in a room. Irritation, to make part of your body sore or painful. Nasal, a nasal part as a bone. Nostril, one of the two openings of the nose. Pinch, to squeeze or press something together with your thumb and finger. Punch, to hit someone or something hard with your fist. Weak, having little power or force, not strong.